Hello, everyone. Today we're going to go over massive transfusion protocol. My name is Mariah. I'm a nurse on nights. This is a part of my EBP through the nurse residency program, as well as the education through with the rapid response nurses. Jessica, Joanne, and I put this together, and let's get started. Some objectives. Thought it was important to go over why an MTP would be indicated, how to activate and implement one, explaining the documentation and any nursing considerations, transfusion reactions, as well as how to use the rapid infuser. But why would our patients need an MTP activated? If they have lost over 30 to 40% of their blood volume, if they have ongoing bleeding with signs of hemodynamic instability, if they are bleeding out, they are going to need blood fast. So the doctors will order for the massive transfusion, and it will also have to be discontinued by the physician as well. We will acknowledge the order, call blood bank 8241 at Farmington Hills, and then we'll get some paperwork. I have pictures of it on the next slide. I'll go over that in more depth. And you're going to want to define roles. You'll have two RNs validating the blood. You'll have a runner. You're going to need to send the runner to the blood bank and obtaining coolers, as well as you're going to need an RN to be on the rapid infuser. It's also helpful to have someone kind of keeping track. Here are the paperwork that you will need. So this blood product dispense is at the nurse's station. You'll need to take this to blood bank with a patient sticker and the BF number. And when you're at blood bank, you'll get this sheet, the urgent request for blood product. And when you actually get the blood, you will get the emergency issue products. And then you'll put the patient sticker on this sheet as well with the BF number. The coolers. So your first cooler will have 3 PRBCs, 3 FFP, 1 platelets. Your second cooler will have 3 RBCs, 3 FFP. It could also have cryo, TXA, calcium, PCC, depending on what your patient needs. And these coolers will keep on coming until you call blood bank and tell them that you don't need it anymore. And any blood that you still have, you can take back to blood bank, but just make sure it's on ice. You don't want to waste any blood. Just make sure that it is on ice before you take it back to blood bank. For access, you're going to want to make sure you have a great 18 gauge. The J loops are actually not power injectable, so you're going to want to just take that off and plug in the tubing right into the IV. And you're going to want to make sure, if you do have a central line, make sure it's power injectable, just to withstand the pressure that the rapid infuser has. For documentation, everything will be switched to paper charting. You are going to want to document vital signs Q5, and I can show you in Epic how you can show that you are switching to paper charting. So in Epic, go under flow sheets, go to the transfusion tab, and then hit expanded, and then you can hit massive or emergent, and then it says to go to paper from there. So again, everything will be paper documented, but at the end of everything, you can put the all of the blood volume into your I's and O's. And eventually all of the paperwork will become a part of the electronic chart as well once it's scanned in. So again, you're not going to do any barcode scanning. So you're going to need 2 RNs to independently check and validate the patient in the blood. And you're going to want to have 1 RN administering the blood from the rapid infuser, 2 RNs validating, and make sure that you are labeling 1, 2, 3 on the blood products themselves as well. Some considerations: the patient's temperature is very important. If the patient is becoming cold, you're going to want to put a bear hugger on them. You'll probably also be drawing a lot of labs, rainbow labs beforehand. You type in screen, coags, Tiger Rotem, and then you will be redrawing CBC, coags, ABGs, Q 30 to 60 minutes. You'll be giving O negative until you have cross-matched blood. And just keeping an eye on the weight. Approximately 7% of our body weight is blood. And for the rapid infuser, you can use the same tubing up to 4 hours. And if the transfusion is stopped for greater than 60 minutes, you're going to have to get fresh tubing. And you cannot use platelets or cryo in the rapid infuser. It may decrease the platelet count or decrease coagulation proteins. So only PRBCs, FFP, or crystalloids in the rapid infuser. Again, some transfusion considerations. To summarize, keep an eye on the vital signs, keep an eye on the lights, and keep an eye on the coags. Patient becomes cold, this slows coagulation. Patient is hypovolemic, they're going to be very hypotensive, probably need multiple drips. In the PRBCs, there is citrate in the PRBCs, and it will bind to calcium. So it may be indicated to replace the calcium. And patient may also become hyperkalemic due to potassium shifts. And something to just consider, if the patient is in shock, they could also have like AKI. It's just important to be thinking about all of these things, as well as the patient could go into DIC, which is a consumption of your coag factors, and the patient will just undergo even more bleeding. Transfusion reactions, just quickly going over some things to keep in mind. Patient could have acute lung injury, could become volume overloaded, could have a febrile non-hemolytic transfusion reaction, or could also get an infection from the blood transfusion. So keeping an eye on the temperatures is important, okay? So for the rapid infuser, we did make a separate video on how to set it up and demonstrating how to prime it. So I encourage you to look out for that video, and you're welcome to kind of read through this step by step in these slides as well. But in conclusion, we really just wanted to empower you guys to confidently activate and implement an MTP. Any emergency is going to be, can be chaotic, can be scary, but that is why, it's important to be prepared. A well-executed MTP can save lives. So you guys are going to do great. Thank you very much for listening. I hope you have a great day. Thanks.